Crohn's disease can be really tough. It's an inflammatory condition of the gastrointestinal tract. That means your GI tract. And literally, Crohn's disease can affect any part of the GI tract, from the mouth all the way down to the anus. Crohn's disease belongs to a group of conditions called inflammatory bowel diseases, or IBD. Now, this is not IBS, irritable bowel syndrome. It's IBD, inflammatory bowel disease. Another common condition that's a part of that sort of class or group of conditions is called ulcerative colitis. So Crohn's can really happen at any age, but oftentimes we diagnose it in adolescents and like adults between the ages of like 20 and 30. We're going to talk about the symptoms, but let me first tell you what actually happens to the gastrointestinal tract. First of all, there's inflammation, as we know, but that inflammation leads to ulcers and a thickening of that intestinal wall. And that can lead to some of the symptoms that we see. Also, in severe cases, there can be things like fissures and fistulas and other major problems with that gastrointestinal tract. And I also told you, remember, it can affect anywhere on the GI tract from the mouth to the anus, but it most commonly affects the end of the small bowel. That's the ileum and the beginning of the colon. Now, in terms of like the ulcers and the thickness and all that kind of stuff that we see with the bowel wall, it can affect the entire thickness of that bowel wall, the entire thickness. And also, some of the inflammation actually can skip throughout the gastrointestinal tract. What do I mean by that? I mean that there's areas of disease, but then there are patches of normal bowel. Okay, so we call those skip lesions. I know you're wondering what causes this. Well, recent research suggests that it can be genetics, hereditary things, environmental factors, even the immune system. Some even call it an autoimmune disease. Now, the thing is that Crohn's is a chronic disease. So this is the thing. People have these symptoms. We don't have a cure for this condition, but we do have treatments. People can experience flares, times when they're doing really great, but then times when their symptoms really flare up. And I know you're saying, okay, what are these symptoms? Symptoms can include diarrhea, persistent diarrhea, bleeding from your rectum, this sort of feeling or urgent need to move your bowels, abdominal cramps and pain, and the sensation that you have not fully evacuated your bowels, constipation, which could lead to bowel obstruction in some people. And this is the thing, there can be complications from those things, okay? Now, a lot of times those symptoms lead to other issues. A lot of people with Crohn's will experience at times loss of appetite. They may have trouble keeping weight on, experience weight loss, have low energy and fatigue. And in children, sometimes there can be delayed growth and development. If you can imagine, your gut is sort of the home and the key to so much of our body and our lives. So when there's inflammation and problems with it, you can see how it literally can affect the rest of our entire body. Sometimes people even need to have surgery to help their Crohn's disease. But let me also give you a few other what we call extraintestinal symptoms. That means symptoms that can happen outside of the intestine. Some people get problems with their eyes, or they get vision changes. Some people get mouth sores or swollen, painful joints, or skin complications like rashes, fever. We talked about loss of appetite and weight loss, fatigue, and things like that. Sometimes women don't have a normal menstrual cycle, may have kidney stones or rare liver complications. So it's not just the gastrointestinal tract. It can have sort of extraintestinal, or meaning outside of the intestine, manifestations. Now, the thing is, I know you're wondering, so how is it treated? Well, there are treatments, okay, to help with the symptoms, to help with the disease. There are medications. In some situations, surgery is needed. It's really, really important with Crohn's. And you're probably also wondering, how is it diagnosed? Well, a lot of times patients come in with these symptoms that they just can't shake, symptoms that are disrupting their lives. And then what we do is we do blood tests. We might do stool tests. There's an endoscopy, which is not a colonoscopy is usually done. That's the colon, but an upper endoscopy, see the upper tract, take a look and see what's going on and take biopsies and get that definitive diagnosis. So rest assured that there is, and we do get definitive diagnoses of Crohn's disease, and there are medications to help manage it, but understand that somebody with Crohn's disease may have a tough time at times, and it can be really tough. Let me know in the comments if you experience Crohn's disease, if you have Crohn's or ulcerative colitis. Remember, both of those are inflammatory bowel diseases, not to be mistaken with irritable bowel syndrome. Write in the comments. I'm Dr. Jen Caudle, practicing family physician. Please subscribe to my channel, click the little bell for updates. Also, follow me on Facebook, LinkedIn, TikTok, WhatsApp, Threads, all this stuff, Instagram. Also, sign up for my free health newsletter at drjencaudle.com.